Hi there, science fans. Welcome to another episode of Science and Other Stuff for Senior Citizens. My name is Dan Casciano. If you like these COVID-19 videos, please subscribe to my channel and ring the bell to be informed of future videos. Today's short video describes some scientific reasons why we need to wear a mask. This slide was taken from an October 25 CNN program that tracks the coronavirus new confirmed cases. Shockingly, as of that date, we had over 80,000 new cases. It appears that we have entered a third wave, and most reliable physicians and scientists are predicting the winter months will be much worse than the summer. This will be true, especially in the north, and this tragedy will be increased because of the onslaught of the influenza season. What is most concerning from these data are the projected hospitalizations and deaths that occur following identification of new cases. Some states are already approaching maximum hospital ICU occupancy. What is so tragic about these projections is that we have a relatively simple remedy for reducing the disease severity and the large increase in deaths. They are the recommended CDC guidelines that include washing of our hands, social distancing by at least 6 feet, preferably 10 feet, avoiding indoor and outdoor crowds, and wearing a mask over your nose and mouth. Since winter is approaching, scientists are also strongly recommending reducing indoor events that include large family gatherings, and if this is unavoidable, socially distance and wear a mask. This slide lists some data that indicate that masks work. COVID-19 daily growth rates were reduced when masks were worn. The cumulative reduction of cases was highly significant when case severity and death rates were measured. Another retrospective study found that countries that had policies favoring mask wearing also had reduced rates of deaths. A recent study reported by Dr. Sanjay Gupta showed that without a mask, the rate of transfer of COVID-19 is 17.4%, while wearing a mask reduces the rate of transfer to 3.1%. This slide and the next slide describe a mathematical model's projection of the number of deaths that can occur from now to February 28, 2021. The model uses the number of deaths from COVID as of October 23, 2020, which is 209,568. The model includes the reported use of mask wearing during this same period. The number is 49% of U.S. residents reporting that they always wear masks in public. Using these data, the IHME model projects that U.S. deaths could reach around 1 million. This is dependent upon the present mask usage and if states continue removing social distancing mandates. The model also assumes that states will again shut down when their daily death rate exceeds 8 deaths per million. Using these assumptions, deaths are projected to reach 513,373 by February 28th. However, when they plugged in 95% mask wearing and social distancing into their mathematical model, 129,000 fewer U.S. deaths would occur. So until a vaccine is widely distributed, we have the means to protect some of us from the ravages of COVID-19. Granted that this is a model prediction that has a percentage of error that is a function of the probabilities associated with the assumptions. However, many of these assumptions are based on historical data and known human behaviors. Why wear a mask at all? Wearing a mask has been shown to reduce the probability of virus spread by nearly 70%. Since many people who shed the virus are asymptomatic, wearing a mask reduces the possibility of infecting another human. That individual may be a healthy person or one with pre-existing conditions that may increase severity of the infection or result in death. This slide shows several ways people wear their masks that I have seen masks worn when I frequented public venues mandating masks. The photo in the top left quadrant seems to be the desired way many individuals like to wear their masks. Not good, because droplets exhaled or sneezed by others or themselves are not prevented from entering one's respiratory tract. The photos in the top right and bottom left quadrants have been observed on many fewer occasions and are the same as not wearing a mask at all. The correct way to wear a mask is seen in the bottom right quadrant. Wearing a mask this way saves lives. For more information about science, visit my website at www.dcasciano.com. If you have any questions or would like me to develop a video on a specific science subject, leave them in the comments section below or email me at dan@dcasciano.com. Be sure to like this video and subscribe to my channel and ring the bell so you can be informed when I upload a new video. Thank you for watching Science and Other Stuff for Senior Citizens. Bye.